The reasons for the disconnect are a couple. One, nutrition is a relatively new science. But I think more importantly, because we all eat, we are all experts. We all have an opinion. We all have a belief about food that is true for us. So if it's true for us, it must be universally true. We don't know how to dress a wound, so we would ask a nurse. We don't know necessarily how to take a prescription medication, so we would ask our pharmacist. But we all eat. So by definition, we are all experts. I also think a major challenge is the understanding of the science is lacking. And I think over and over throughout this course, what you'll find maybe challenging is we're going to uncover the science and maybe put to the side or challenge your thinking about nutrition and food. Well, we're going to start out by looking at this whole science by going through a brief history of nutrition. The first known reference to nutrition was by Hippocrates about 2,500 years ago, where he said, "Let food be thy medicine, and let medicine be thy food." Now, I think that's probably one of the more powerful supports for nutrition, and look at the age of that quote. I think it's an absolutely brilliant assessment of the role of nutrition in the management and prevention of chronic illnesses. But in the United States, we're still really in our infancy. The nutritional history of the United States first started out, and there are some other key findings. I'm just going to give you the highlights here. Wilbur Atwater in the late 1800s actually provided the first foundational information regarding metabolism of food and energy requirements. Throughout his work, this brought attention to the word calorie. Calorie being a unit of measure that it estimates how much energy is used in the conduction of work or metabolism, and this was again in the late 1800s. During the first 50 years of the 20th century, discovery of essential nutrients highlighted the nutritional science here in the United States as well as abroad. So I think during this first 50 years, we were thinking about vitamins, vitamin C, vitamin D. These were all being discovered and their role being elucidated in human nutrition. Casimir Funk in 1912 proposed what he called the vital amine theory as a cure for most common nutritional diseases, most notably beriberi. Amine is a part of a protein molecule, and Funk believed that a vital or essential amine or a protein was the missing compound in white rice that was lacking what he called thiamine, now that we know it's thiamine, a B vitamin, that was the cause of heart failure and beriberi. The milling of brown rice caused the removal of the bran, which was an excellent source of this B vitamin. So in his discovery, what he learned was that taking off that outer layer of bran really decreased the nutritional value of food. He thought it was a protein, wasn't a protein, it was a B vitamin. If we fast forwarded, thiamine is now added to white rice as part of fortification. In the early 1930s, William Cumming Rose made landmark contributions in the area of protein metabolism and the requirements of protein. I have to tell you, in my dealing with athletes, the big challenge oftentimes with athletes is getting them to realize that when William Cummings Rose made landmark contributions in how much protein we require, he never said more was better. He never said eat all the protein that you want. He actually gave us boundaries of protein requirements that still in this day and age we are attempting to step over, particularly in the athletic world or the bodybuilding world. One of my favorite landmark works was the work of Ansel Keys on starvation. And he did what is now known as the Minnesota Starvation Study. I will tell you, in this day and age, the Minnesota Starvation Study would never be approved by any research group or institutional review board because it's sort of unethical in this day and age. But what Keys did is he took conscientious objectors to World War II, men for religious reasons who did not want to fight, and he voluntarily brought them into a research facility and dropped about 25% of their body weight. Now think about that for a second. You come in, you're already at a normal weight, and I get you to lose 25% of your body weight. Well, his medical findings were really pretty outstanding. What he found was that in individuals that significantly reduced their calories, The body adapted. It slowed down its metabolic machinery, and we now had an idea that metabolism meaning the amount of calories that you burn at rest, could be significantly impacted by dropping 25% of your calories. Heart rate goes down, body temperature goes down, blood pressure goes down. All of those decrease. And I have to tell you, in the clients that I take care of who have anorexia nervosa, we see the exact same medical findings that Keyes helped us to understand in the mid-1940s. What Keyes also found, which to me was unbelievably outstanding, was that when you reduce calories significantly, when you drop those calories by 25%, you have changes in your mental status. You have changes in your mental status. Irritability, confusion, inability to focus. So think about times in your own life that you've been unbelievably hungry. I will tell you personally, for me, not terribly pleasant to be around, get a little cranky, a little irritable. But if that goes on beyond just missing a meal, and this is chronic, people become socially isolated. They don't really want to go out and do anything. Oftentimes they'll cut up their food in lots of different pieces around their plate, move the food around, and become so focused in on the event of food that it excludes other things. In Keyes' study, these were all young men, and they weren't interested in being with their wives and girlfriends anymore. They weren't interested in playing cards. All they were interested in were recipes and cutting out pictures of food in magazines. Very similar to what we see in anorexia nervosa today. Young women and men who have anorexia nervosa oftentimes really focus in on the arrangement of food in their plate. All of those findings that Keyes opened up that door and let us know about in the 1940s. The 1950s were really signaled by the advent of fast food. And I will tell you, I think fast food oftentimes gets a bad reputation. It gets a bad reputation because we think fast food alone is responsible for the increase in obesity that we see in our country. When McDonald's was founded in 1954, you could go in and get a hamburger, french fries, and a soft drink for around plus or minus 700 calories. Well, now a fast food meal, if you go in and supersize it, is 2,000 calories. So reflect back to, it's the portion sizes and that increase in calories that we've seen since the 1970s that are crystallized in that statement. Well, now, if we look at from that work of Keyes and through the 1950s with the advent of fast food, we're now looking at a shift from nutritional deficiency diseases to diseases of nutritional excess. And that has been the focus of nutritional science since the 1970s. We are interested in preventing heart disease or managing heart disease, and we are interested in the prevention of diabetes. So I think when you think just about the changes in nutritional philosophy since the 1970s with heart disease in the 1970s, probably the most landmark study, really looked at the use of polyunsaturated fats, liquid oils, corn oil, safflower oil, sunflower oil in the management of heart disease. Well, if we fast forward to today, we're still interested in oils, but we now have comments on trans fats, which we'll explore in later lectures. Saturated fat. We've dissected that out and actually made this more of an exact science from where we were in the 70s. Diabetes. I think diabetes is going to be the tsunami of disease that gets us in this century. When you look at statistics, it has been estimated that a child born in the year 2000 has a 1 in 3 chance of being diagnosed with this disease. 1 in 3 chance. When I first started out as a clinical dietitian, I didn't see children who had type 2 diabetes. We think of type 2 diabetes as adult diabetes. Sometimes it's referred to as obesity onset diabetes. I think the real tragedy is that we're now seeing children at younger and younger ages with type 2 diabetes. At Texas Children's, the youngest child with type 2 diabetes that we've had is 4. And again, in 30 years of practice, I never thought I would see that. Well, I'm also now going to give you some real good news. Talked a little gloom and doom here, but I'm going to give you some good news. Diet and exercise can help. Diet and exercise can really help that management of chronic illness. So we've looked at this nutritional history and said, aha, since 1970, we are really focusing on nutritional excess. Well, this is where this course comes in. Diet and exercise can be that roadmap. It can be those steps to wellness that we're all looking at. The question is, how are we going to come up with good sources of nutrition information? Where will we get that from? Are we going to be evidence-based? Are we going to go to the science to get the information? Are we going to go to less reputable sources? Well, certainly I'm going to direct you to the science of nutrition. We're going to talk about the building blocks. How do we get from our first step on the road to the end? We're going to talk about how your body digests food. Again, I think one of the real challenges is we have a disconnect between what we believe to be true about digestion and what actually goes on. And so we're going to uncover that roadmap to digestion. We're going to talk about proteins, carbohydrates, and fats. What's good, what's not good, how much, what's the balance. We're going to talk about vitamins and minerals. And as we explore that science, we're not going to just talk about how much you need vitamins and minerals. We're also going to look at, is there any harm in taking vitamins and minerals? And some of the more recent science suggests yes, that because a little bit is good, a small amount is good, does not mean a lot is better. In fact, when it comes to vitamins and minerals, a lot can actually be harmful. We're going to explore calories. How many do you need? How do you know how much you need? We're going to talk about water. We're going to talk about fiber. We're also going to, again, come to these nutrition-related disorders and how to combat them through good nutritional choices. We're going to explore the big ones, cardiovascular disease. Certainly, no course on nutrition would be complete without talking about overweight and obesity. Really, the next big public health emergency in this country is going to be overweight and obesity. Metabolic syndrome. What is metabolic syndrome? Metabolic syndrome is kind of like prediabetes, digestive disorders. We're going to talk about cancer. We're going to talk about food safety. And along those lines, we not only have to talk about these foods, but we have to talk about nutrition in your own life. How do you actually read a food label? How do you take all that information, make it personal, create your own nutrition and exercise plan depending on where you are on that wellness roadmap? We're going to talk about understanding herbal therapies. Are they good? Should I take them? Should they replace conventional medicines? We're going to talk about this category of functional foods. We're going to look at organic versus conventional foods. And now we're going to go back to whatever happened to that girl on that crazy lemonade, cayenne, and maple syrup diet. We got her off that diet. We got her off that diet onto something sensible. Because could she maintain that diet? Could she live on lemonade and maple syrup and cayenne pepper? What happens if she wanted to go out to eat with her friends? What happens if she was going to a sleepover? What happens if she had a job? She can't hang on that diet. So we replaced the fad, we replaced the hype, and substituted in its place something she hadn't thought about. Maybe I should get up in the morning and eat breakfast. Maybe I should not skip meals. Maybe I should stay away from large portions of fast food. And yes, she lost weight. Can I tell you that she lost all the weight that she wanted to lose? No, that wouldn't be true. But she lost weight in a sensible way that was integrated into her lifestyle. And that's what we're going to do in our nutrition course. We're certainly going to talk about some frequently asked questions, things that I hear all the time. You know, should I do this? What about drinking sports drinks versus water? We're going to mention those along the way. So as we go through this course on nutrition, we're going to replace the hype with the science and make this a personal roadmap to wellness.